Anyway, I am more than thrilled to introduce Amy Hopper, who I feel like has just really developed a tremendous therapeutic modality, and I'm excited to hear what you have to say tonight. So thank you so much for coming.
Thank you so much, Jeannie. Thank you. And thank you for organizing this. Jeannie and Michelle and Charlie, I just want to say thank you. Where's Charlie? He's in the back somewhere?
Please, parking in the car.
Oh, he's coming. So I just want to say thank you so much for inviting me here to speak tonight. It's my honor to be here to share this information with you. And as you know, we're all in the field of medicine and health, and that's our goal, is to help people get better. And you know, so much like you, we have much in common. My goal is the same, is to assist people and decrease suffering. And I'm very blessed and grateful to be in the position to be able to do that. So thank you so much for coming. I'm going to talk tonight about the brain, chronic illness, and limbic system rehabilitation. The presentation that you're about to see is much like the presentation that I presented at the Institute for Functional Medicine in June of 2017. And I'll just start there. So, who am I and what can I possibly teach you? It's a really good question. I think I would like to start by telling you a little bit about my story and how I got here. So it was 2004, and I was living an active, healthy, really engaged life in Kelowna, British Columbia, Canada. And I was working as a core belief counselor at the time, and that's not a licensed counselor, just so that you know. But I was working with people looking at belief systems that might hold them back in life, from joy, love, or success, and really looking at patterns. So specific thought patterns, emotional patterns, or behavioral patterns that might lead to undesirable outcomes. And specifically, I was looking at emotional childhood wounds and how they might manifest in your adult physical reality. So I saw a lot of overlap, and I was quite successful at what I did. I loved what I did. I taught workshops, group workshops. I did one-on-one work with people. I had a newspaper column that I wrote every week called Emotional Rescue, where I would teach people how to be the curious observer of self. And also I was featured on local talk radio as an expert in emotional wellness. Yet, despite all of my knowledge and experience, nothing protected me or prepared me for a limbic system injury. So in the building where I worked, my office was located right next to the janitor's supply room. And what I didn't know at the time was that the building also had mold. And prior to moving in there, I had a car accident about a year earlier that left me with a neurological shake in my neck that mimicked Parkinson's. I came from a family home of a lot of childhood emotional trauma. And let me state by saying I don't think that emotional trauma in and of itself will be enough to create limbic system impairment, but certainly it can be a contributing factor. So that was my perfect storm to developing limbic system impairment. So emotional trauma, plus chemical exposure, plus a physical car accident, neck injury, and exposure to mold in the building where I had an office as well. So that was a perfect storm for me. So what I started to do was really look at how I could get better. Really, that was the only question, is how can I get better? Because the symptoms started on a physical level. So I had a lot of headaches that I couldn't get rid of, and then I had a sensitivity to smells. My sensory perception heightened through sense of smell and taste. I could taste and smell chemicals from a mile away. I also started to get muscle and joint pain, chronic pain. I would lose my voice. So if I was working with someone and they happened to hug someone else that had perfume on and they walked into my office, I would immediately lose my voice. And I thought, well, this is very strange. It's not an allergy, but it certainly is peculiar. I also had a lot of neurological symptoms. So that looked like word searching, not being able to connect words in a sentence. So I knew what I wanted to say, but my brain couldn't actually formulate it, and my mouth wouldn't work to actually get the words out properly. What else? Oh, and neurological symptoms like seizure-like reactions to everyday common chemicals. So if I was walking down the street and someone was doing their laundry and they happened to have, fabric softener in their dryer, if I walked by that if I walked by the fabric softener fumes, I might go into seizures. So it was becoming really difficult to navigate my life. And then, I went to see so many different doctors and specialists, I can't even name them. Practitioners, doctors, neurologists, specialists of this kind, of that, of that, of that. I detoxed until the cows came home. I detoxed Mars and back. So surely, if detoxification was the issue, I was clean as a whistle. And yet, the symptoms were getting worse. And then, just like out of a science fiction novel, I developed electromagnetic sensitivities, which meant that I was sensitive to all electromagnetic fields, which meant things like my refrigerator, or cell phones, or wireless. So you can imagine what it's like to try to navigate in a world where you can't handle wireless. So that's the point. That is the point where I became homeless. And not because I didn't have money, or because I didn't have friends, or there weren't 20 well-meaning physicians in my area or friends that would help me, but that my system became so sensitized that I couldn't be around anything. My brain was now interpreting the smallest amount of chemical as potentially life-threatening, the smallest amount of electromagnetic field as potentially life-threatening. And not only did it feel life-threatening, it was absolutely presenting with symptoms that were life-threatening. So, I started, even before this happened, I started to research the brain because I thought, I know it's not an allergy and it's not a detoxification issue, so what could it possibly be? So I started to look at what was the area of the brain that's responsible for sense of smell. And I looked at the limbic system. The limbic system used to be known as the rhinencephalon, which actually means smell brain. So I thought, okay, there's something wrong with the way that my brain is interpreting sensory stimuli. So I looked at a lot of research and overlapping research and became my own guinea pig in learning how to change limbic system function. And as a result of that, I actually recovered. I lead a normal life now, and I get to travel all over the world and help people heal themselves and teach them how to rehabilitate the limbic system. I talk at doctors' conferences, and I'm just generally in a very blessed position to witness people recover from illnesses that used to be incurable, or the really difficult patients that you probably see, the ones that haven't been getting better no matter what you try to do. So I'm in the very blessed position to be able to witness that. So that's where I'll start. So tonight we're going to describe the limbic system, describe how various forms of trauma can affect the limbic system, outline the concepts of the dynamic neuroretraining system, and describe how and why it works, describe the role of the primary practitioner in the recovery process, and present data that supports DNRS as a viable treatment. So the limbic system is known as the feeling and reacting brain. So it's kind of interesting. It's this really old part of our brain located in the midbrain, and really what it does is it filters billions of bits of emotional and sensory information and categorizes that information into two very distinct categories, threat or non-threat. And you can imagine if the system is not working functionally, it will start to categorize information as threatening that is not threatening. It's interesting how it really is like a guard at the gate. It's a sensitive security system that's trying to protect us all the time in every environment that we're in. And the system actually can detect potential threats both externally and internally. So not only if you're in a car accident or there's an emotional trauma going on or emotional upset, but also internally with threats of virus or bacteria. Isn't that interesting? And that all happens unconsciously, below the level of our awareness. So in fact, our limbic system is designed in a really great way to protect us. And thank goodness, because it does have a really great function when it's functioning in a healthy way. So the limbic system, let's look at some of the structures in the limbic system, and it depends where you look. There could be more structures in this, but we're just going to talk about 4 of them. So first, let's look at the amygdala. So the amygdala processes survival-related information and encodes emotional memory. It's also known as the brain's fear center, and it responds immediately to our environment, not only to real threats, but also perceived threat. The hippocampus is located right next door to the amygdala, and it's the area of the brain that's known for memory, both short and long-term memory. And it processes and stores information. It also assigns meaning and value to information, which is a good thing. That's why we don't have to learn the same thing over and over and over again. It's involved in survival and protective reflexes as well. And we'll look at the hypothalamus, which is known as the brain's internal chemist. It's always trying to find a state of homeostasis, and you guys all know this, of course, releasing all kinds of hormones or neurotransmitters at any given point. It's it's also involved in behaviors involved with eating, drinking, sensory alertness, energy levels, rage and aggression, embarrassment, escape from danger, pleasure, and sexual arousal. It is a center for powerful brain hormones. And what's really interesting about the program is that we assist people in really being able to activate their hypothalamus and producing their own positive neurochemistry to dampen a chronic stress response that's been activated by limbic system trauma. So the cingulate gyrus is another area of the limbic system, and looking at the cingulate gyrus and its functions, what occurred to me as I was studying this area of the brain was it's responsible for the mediation of a noxious stimulus response. And I thought, my goodness, that's interesting because it doesn't feel like I have any mediation of noxious stimulus happening. It's just constantly everything is noxious stimulus. So it's involved in mediating that noxious stimulus response, but also it's involved in alerting the amygdala about what to react to. It's also involved in where we focus our attention. So this particular part of the brain really got my interest. And causes of limbic system impairment, and we're looking at, what is the perfect storm, and many of you have probably seen this in your patients, right? Maybe they have a mold exposure, plus they have a physical injury. Maybe they've been exposed to chemicals, or they have underlying viruses or bacteria. Perhaps they've had excessive EMF exposure, or they've suffered from emotional trauma, or one-time psychological trauma as seen in post-traumatic stress disorder. So everybody has their own perfect storm. Sometimes the illness is gradual in onset, where it may take years to develop, and other times it happens overnight. People just hit this flipping point or tipping point, and they start to exhibit with symptoms of limbic system impairment. So for me, a recap, my perfect storm was a car accident, physical injury, mold exposure, emotional trauma as a child, and what was the other one? Cleaning, chemical exposure, right? Thank you. You guys are paying attention. Thank you. So, the perfect storm could look different for different people. We just happened to finish teaching a program last week here in Austin. We had 20 people from around the world came to this program. So I thought I'd share some of their perfect storms with you and tell you what the results were that they noticed after the program. Some of them have already been working with the DVD, and some of them have not. So, for example, Mo, she's a female, age 49. She was working with the DVD prior to attending the program. The perfect storm for her was, she said it started with a simple cold originally, and then triggered Then she developed chronic fatigue syndrome when she was 34, then neurological decline at 42, then a toxic dose of an eye drop antibiotic in 2016. So she'd been suffering for 8 years. And at the end of the program, we say, so what kind of changes have you noticed? She said, well, her appetite is back, which is huge, right? She's actually hungry, so looking at hypothalamus function. She could eat more foods, so she wasn't sensitive to as many foods. She has better energy, less pain, and less depression. So yay, Mo, good for you. BK is female, she's age 65. She'd been working with the DVD. Her perfect storm was, what was her first? Emotional trauma and a perfume exposure. And for 3 years, she's been suffering from extreme sensitivity to smells, toxic overload from a chemical work environment, chronic pain and energy loss, lack of motivation, depression, and hopelessness. And in her reports, she said, my foot pain is gone, exclamation mark. My hips and shoulders do not have pain now. When I smell, when a strong smell comes, I do not need to panic. I feel joy. I feel, period. I am no longer a dead man walking. So I think that's really interesting how it actually acts on that emotional center of the brain and people start to be able to feel emotions again. Let's go to Jana. Jana is a female, age 30. She was working with the DVD prior to attending the program. She's been sick for 17 years with Lyme, postural orthostatic tachycardia syndrome, multiple chemical sensitivities, mast cell activation syndrome, mold illness, and post-traumatic stress disorder. The perfect storm for her was a tick bite at age 2, symptoms at age 13, plus a car accident, plus mold exposure. At the end of the program, it was interesting, Jana didn't even actually recognize most of her improvements. So one of the improvements was the week before she came to the program, she was at her doctor's and she could not stand up because she would lose her balance. So during the program, she was standing up with her eyes closed for at least 10 minutes. And I reminded her of that and she went, oh my goodness, I was actually standing and I didn't fall over. The other thing, she had decreased blood pooling in her legs. So that's a common symptom with POTS, autonomic nervous system dysfunction, is this blood pooling in her legs. Usually she would have to wear compression stockings, and she wasn't wearing compression stockings, and she had decreased blood pooling in her legs. So that was pretty fantastic. And yeah, she wasn't wearing her compression stockings. Let's take a look at, Patricia, this is really great. Patricia's an occupational therapist. She's age 55. She had, let's see, all conditions. Let me take a look here. Unexplained illness over the last 4+ years, weakness, infections, pain in her forearms, in her solar side, legs, and low back, numbness at times, history of Epstein-Barr, car accidents, dizziness with some transient cognitive changes, decreased fine motor movements, fear of not improving and decreasing quality of life, pulling back from social events, working less hours and wanting to quit. She said, I treat patients who are better off than I am. And she's been suffering for 6 years. The perfect storm for her was head injuries, plus Lyme, plus child abuse, and relationship abuse with an ex-husband, a loss of her mother, and pesticide exposure, and a son with mental health issues. So, at the end of the program, she reported decreased throat clearing and swelling by 50%, 0 facial numbness, decreased anxiety, increased energy, and 0 pain. And then she put, what? Question mark? No, really, no pain. So thank you, Patricia. We're really excited for you. And you know what? Even though they have these, which seems like transformative results within a short amount of time, within a few months, for some people, they'll have to practice on a regular basis every day and commit themselves to this practice day in and day out for a minimum of 6 months to really see permanent changes in limbic system function. And Laura was really interesting. Her mom's a retired physician and they flew over from Austria. Laura's 33 years old. And I've never actually seen anything like this, actually. Laura was frozen in a freeze response most of the time. She was not capable of talking very much, and the only thing she did say when she talked was all about survival in a very OCD way. She said, "When are we eating? What are we eating?" 2 seconds later, "Where are we eating? What are we eating?" And I thought, okay, let's see what happens. I have no idea what's going to happen with this. And it was interesting. She was also unable to maintain eye contact. She was hovered by her mother in fear. What else? Oh my goodness, there were just so many things. She would not engage with people. She was just had a very low affect, like no affect, just like this frozen face. And during the period of 5 days, actually I'll let her mom tell you. So she's been suffering for 27 years. The last 3 years have been really bad. She had lost her sense of tactility, smell, and taste initially. She lost her she had a heightened sense of smell and taste, and then she lost it completely. Then she developed sensitivities to light, sound, touch, EMFs, food. She had anxiety, fatigue, and cognitive dysfunction as well. What can I tell you? This is what her mother reported. And her mother has to care for her like an infant. So her mother reported her physiology changed. She had increased bowel movements, increased control of her bladder, increased vitality, could stay for the whole program, increased circulation. She had warm hands and feet for the first time in years, no migraines, decreased teeth grinding, increased coordination and balance, increased endurance, decreased sensitivity to light and especially to surrounding noise, decreased sensitivity to sense, and she was more focused and started independent behavior. She was actually able to shower by herself and went to the bathroom by herself. So that was a really big deal for her. We were extremely excited for her. So I was looking at some research. What I found was a common denominator was that there was over 500 threatened survival mechanisms in the limbic system that were involved with fibromyalgia, multiple chemical sensitivities, Lyme disease, chronic fatigue syndrome, and I would add anxiety and depression as well. So limbic system trauma, if you look at injury to the limbic system, again, it's like our highly sensitive security system, but it's now gone awry or gone rogue. And that results in distorted threat evaluation, damage and disorganization or cross-wiring of neural circuits in the limbic system, and a maladapted stress response. So you can imagine this is it can affect all systems of the body. So there's structural changes that actually take place in the brain because neurons that fire together wire together. So when that reaction or maladapted stress response is repeated enough, it just becomes an automatic response in the brain without our conscious awareness whatsoever. And there are structural changes that take place in the brain, and I can't wait to have some brain scans done to see how the brain is changing with this form of treatment. So in Flight or Fight, we focus on the body, environment, and time. I really love this slide because it really encapsulates what limbic system impairment is like. So when we're in limbic system, when we have limbic system impairment, we're totally in a flight, or freeze state all the time, whether we think about it or not. So when we're in that state, we focus on our body. So what is he's focused on running, right? The environment, what is he running from? The hand. And when is he running? Now, right? He's not running 2 minutes from now, he's running right now because he feels completely threatened. So it's kind of like if we're being chased by a tiger all the time. You can imagine that if we're being chased by a tiger, that issues like eating won't be as important because we don't have time to eat. And even if we did eat, our body wouldn't absorb nutrients and we wouldn't be able to excrete waste products because we'd be in that flight or flight state. Because when we're in flight or flight, the cell walls actually start to shut down. It affects the cell on a mitochondrial level, right? We'll be speaking a little bit about that research in a minute. But looking at, it affects communication. It's our ability, the actual body's ability to communicate with its own cells. So communication is damaged because of that. Because you can imagine if you're running away from a tiger, it's not important to take a selfie, and it's not important to phone your friends to tell them about it, right? So you're totally focused on the body, your body environment and time. With limbic system impairment, when we look at time, it's a little bit different because we find the people that have this are really focused on trauma that happened in the past, and projecting trauma in the future. So, and it's like this, the brain is just stuck in this trauma loop. So it goes back to the past and it starts projecting into the future. And it's not because these people aren't smart, because we're all smart, and you know, I know a lot of doctors that have taken the program and have gone through a lot of psychotherapeutic work and have done a lot of work on themselves in dealing with past wounds and dealing with emotional wounds from the past. And yet, when the brain is in limbic system trauma, it actually brings that back up again. Even though you think that you've dealt with it years ago, it'll start bringing it back up again. For no good reason besides the brain is stuck in this trauma loop. So, we look at a limbic system trauma feedback loop. You have some form of initial trauma. It activates an inflammatory response and impairs limbic system function. It creates a protective and distorted stimulus reaction. It affects the hypothalamus, which regulates our internal chemical environment, the amygdala that activates the flight or flight response and the HPA axis, the hippocampus that stores memory of trauma for future protection, and at the end of this, we release more stress hormones, right? So after release more stress hormones, what that leads to is something called limbic system priming, where we need less and less of a stimulus to have the same or greater reaction. What it also leads to is limbic system kindling, and you can think of the word kindling like kindling in a fire, which means that the sensitivities start to spread from one system to another, one stimulus to another. And what eventually happens is you get into this chronic maladaptive stress response, which affects the HPA axis. So the body is taking cues from the brain. Is it safe? And the body says, no, it's not, because we're releasing stress hormones all of the time. So we get into this looping stress response. And there's a beautiful image of some neural connections in your brain. Isn't that lovely?
Yeah.
What a beautiful brain. So let's look at what's happening at the cellular level. So I was talking earlier to someone about this study. It's called the metabolic feature of the cell danger response by Robert, how do you pronounce his last name? Navio. And this came out in 2014, and what he was talking about was the cell danger response is an evolutionary conserved metabolic response that protects cells and hosts from harm. The CDR affects basic metabolism, energy production and expenditure, absorption, detoxification, and communication. So I would suggest that this is happening. I think that the limbic system can actually send the messages to the cell danger response, and I think that that can be turned off so that the cell and the mitochondria are working functioning again. Is everybody with me? Okay, excellent. So the physical cost of limbic system impairment, it often affects multiple organ systems, your respiratory system, cardiovascular, musculoskeletal, immune system, endocrine system, gastrointestinal, and reproductive. It results in heightened sensory perception, and then that heightened sensory perception can actually become the trigger and cause that unconscious stress response as well. So not only do you become sensitive to light and sound or smells or touch or whatever, but then that actually creates a trigger for you. So you become more and more sensitive as time goes on. So for some people, they have to be in a completely dark room with no light, no sound, no nothing. It can actually feel like you are being poisoned. And I don't know if anybody here has suffered from MCS. I know there are at least 2 people in the room that probably have in the past. So not only does your sense of smell increase, it changes. So perfume actually smells like pesticides. And your cleaning products actually smell like poison. So it constantly kind of feels like you're being poisoned all the time. And not only can you smell it, but you can also taste it. So it's really, I remember going to my doctor one time, one of my very well-meaning doctors that I went to, and I said, I'm not really sure what's wrong with you. And at this point, I'm wearing a mask and all kinds of things. I said, I'm not sure what's wrong, but I can actually taste your underarm deodorant. And he said, yeah, I know. He said, but Annie, you're really sensitive. I don't know what to do. And I said, yes, I am. You're right. So over time, the sensitivities can increase. A patient may start reacting to a lesser amount of stimuli, more classes of chemical substances if they have chemical sensitivities, like synthetic fragrances, smoke, pesticides, and maybe even progress to natural or inert substances like flowers, essential oils, or food smells. Sensitivities may also spread to other forms of sensory stimuli such as touch or pain, sound, light, food sensitivities, and ability to detect electromagnetic fields. Extreme harm avoidance plus fear equals increased limbic system dysfunction. I'm going to take a minute to talk about this. So you can imagine if the fight or flight centers are firing too rapidly. So you've got this rogue threat and protective mechanism that is firing way too rapidly. And you figure out on your own that if you don't go near the stimulus, that you won't have the reaction. So what we do is we try to avoid everything that creates a reaction of any sorts. But the problem with that innately is that avoidance and fear can actually strengthen the maladaptive pathways that are at play. So we really want to be careful with how we present information and what that information is so that we don't scare patients that actually have this dysfunction to begin with, because any information that you're giving them is being viewed through the lens of threat. So really engaging with your patients in a positive way and assuring them that yes, that recovery is possible is a really great way to do that. Distorted sensory perception plus heightened symptoms of knowledge plus knowledge of toxins equals avoidance. So yeah, like anyone else, when I started to get sick, I started to research what was in everything that was making me sick. And I thought, well, no wonder I'm getting sick. In some ways, it validated why I was getting sick. I was like, of course I'm getting sick. Did you know what's in shampoo? Did you know what's in your body lotion? Did you know what's in your cleaning products? My goodness, there was just this vast network of knowledge that was available to me that really confirmed why I would react with such an intense degree to chemicals or things in my environment that were not healthy. So that really confirmed for me that there was a reason why to be sick. And when I went to a lot of well-meaning physicians, they said the same thing. They said, did you know about the toxins in your environment? I said, yes, I do. Well, did you know about this one? No, I didn't. Did you know about that one? No, I didn't. Are you avoiding everything? Well, I'm trying my best. I'm trying my best. Okay, well, remove gluten, remove this, remove that, remove that. Okay, I've got a clean diet. I am avoiding everything. I am doing everything. I am taking all of the supplements. I'm doing all of the therapy. I'm doing everything. And yet what happened? I didn't get well. I got even more sick. So, damage can also alter the way you think and emotionally respond to your environment. Does anybody ever feel like this? So interesting with limbic system impairment, because it really is the emotional center of the brain too. It's the feeling and reacting brain. It can actually change the way that we respond, that we emotionally respond. So for some people, they're overreactive, emotionally overreactive to small events. For other people, they are stuck in a lot of limbic system related emotions. So fear, worry, anxiety, hopelessness, suicidal ideation. What else? I don't know, they're just stuck, paralyzed in those emotions pretty much. So what happens is, naturally, they don't have access to positive emotional states because the brain is stuck in survival, and feeling good is not associated with survival. So you don't have the luxury to feel good when you're in survival, right? Do you laugh at a joke if you're in survival? No, you don't care, right? So I turned into that. I went from being this really giggly, loving, kind of upbeat person that would make a new friend every day into this terrified, depressed, hopeless person, a shell of my former self. So I was looking at the patterns that I was running. What are the psychological patterns? What am I thinking about? And I looked at them and I thought, oh my goodness, you know what I'm thinking about? Trauma. All the time. And not really consciously. It was just, there it is. And I thought, okay, well, I know what to do with that. I'm a very skilled person. I know the tools that I used to use when I had a healthy brain that helped me with all of that. So I'm going to use those same tools and get out of this rut, this negativity rut. And even though I used all of the same tools that I used to use with a healthy brain, I would do all of that work and 10 minutes later, it would be back again. So I thought, oh my goodness, my brain is actually stuck in trauma. And even though I knew that there was something to feel grateful for in my life, that I had had lots of great experiences in my life, I could not think of one of them. And I thought, wow, that's interesting. I can't remember anything positive. I can't change my emotional state. And I just feel hopeless all the time. I'm sure that you probably have patients that feel that way too. For some people, it looks like zero affect. No affect. So even with the appropriate emotional stimuli, they cannot cry. So even at the death of a loved one, they cannot cry because they just don't have access to their emotions at all. So that's why when I read VK's shift, she said, I'm no longer a dead man walking, because she's actually starting to feel again. I think I've covered most of that. Yeah, so it can look like rage and aggression too. So, you know, people generally with limbic system impairment are not the most friendly people that you'll ever come across. And they're frustrated, and rightly so, because they've been sick for a long time and they feel like they're dying, and their body is telling them that, and their brain is stuck in this trauma cycle, and it's affecting a lot of systems of their body, so no wonder they're like that. But part of that, it's situational, but part of it is also a symptom of the dysfunction itself. Is that making sense? Good. So repetition of unhealthy patterns can structurally change the brain. I like talking about this. This is about Leonardo DiCaprio in his role in Howard Hughes in the movie The Aviator. So when he was studying his role, he worked with Dr. Jeffrey Schwartz, who is a guru of OCD, and he said to Jeffrey, he said, teach me what it's like to have OCD. Tell me what to think. Tell me how to feel. Tell me how to behave. So he did his role so well, he actually won an award for his role, but also in the process of character acting, he actually developed OCD. So he had to work with Jeffrey Schwartz for up to a year after he finished the film to reverse what he did to his brain through character acting. So what we think has very real ramifications on brain structure and function. How we feel has an effect on brain function and structure, and how we behave as well. So, interesting story. Emotional and psychological cost. Overactivation of threat centers in the limbic system are related to survival emotions including fear, rage, anger, worry, depression, hopelessness, and catastrophic thinking. Patients are often emotionally overreactive to stress, which worsens physical symptoms. And some cannot cry with appropriate stimulus, even with the death of a loved one. They have the inability to genuinely laugh. They have general difficulty accessing positive emotional states and positive memories. They have an exaggerated startle response and extreme harm avoidance behaviors. You can imagine that isolation and feelings of abandonment go hand in hand with limbic system impairment. And patients are often not taken seriously by their medical doctors and often go undiagnosed or misdiagnosed for many years. The cost on quality of life, they have a very poor quality of life, extreme isolation. For a lot of people, they're unable to socialize anymore. They don't have hobbies, they can't go to church or be part of any group activities. They're unable to access basic healthcare needs like going to the doctor or dentist. For some, they're unable to travel, they can't fly or stay in hotels or stay with family and friends. And often people become housebound, or they have strict environmental guidelines imposed on others, and a lot of them are unable to work, right? And You know, you'll hear me reference chemical sensitivities quite a bit, but it doesn't really matter if it's multiple chemical sensitivities, chronic fatigue syndrome, Lyme disease, co-infections, food sensitivities. I mean, if you have food sensitivities and you're extremely food sensitive, you know how much that isolates you from being a part of life, because a lot of our socializing is around food and around enjoying food with other people, so that's quite isolating as well. So traditional therapeutic techniques, let's talk about that for a second. So in a traditional therapeutic model, and working with someone who has a healthy brain, you would go back into the past, reframe it, change the emotional content, and it would structurally change the brain because you've changed the emotional charge with that specific event. It will actually change the neural networks for that memory as well, which is really great. Aren't we? You know, we're really fortunate to be able to do that. However, with limbic system impairment, going back into any form of past trauma is very counterproductive when you're dealing with someone with limbic system impairment, because the brain is stuck in trauma and it doesn't actually know the difference between trauma now, trauma in the past, and trauma in the future. If you go to trauma, what's happening is you could inadvertently be actually strengthening the neurological pathways at play. Is that making sense?
The first one is recognition of limbic system impairment and distortions. So, and we're talking about distortions on many different levels, not just thought distortions and emotional distortions, but behavioral distortions as well, and looking at what are the behaviors that are associated with limbic system impairment, and how do we bring those unconscious patterns to conscious awareness and redirect the brain in that point, in that moment in time. So that is really one of the key pillars to recovery. The second one is identifying and interrupting all pathways of the past. So again, looking at thought patterns, emotional patterns, and behavioral patterns that are involved with limbic system impairment, and redirecting as soon as you notice those patterns or become aware of them. I want to go back to pillar number 1 for a second. So I think a lot of times, even people that are in the program, a lot of times what they forget is this first pillar, is that this is a limbic system impairment. And it's interesting because the brain has been altered through trauma. And the way out of this impairment is actually to change the brain in a positive way, to get it back into that functional working order again. So the brain has been injured from trauma, which has created negative neuroplastic changes in the brain. And through neuroplasticity, we're actually going to get out of that trauma response. So often it looks like they're still chasing symptoms, they're still worried, they're still afraid of the environment, they're still focused on 10,000 other symptoms, but not focusing on rewiring the brain. So rewiring the brain has to be one of the most important things that people do. Identifying and interrupting all pathways of the past, or which we call POPs, so thought, feeling, and behavior patterns that might be associated with limbic system impairment. The other one is to complete full rounds of the DNRS steps for 1 hour per day. So we have a series of practical steps and exercises that we take people through that not only ignite the neural pathways that are associated with limbic system impairment, but redirect the brain in that moment, change the neurochemical cocktail for that period of time, and decrease firing of those threat mechanisms. And it involves relabeling what's going on, recognizing what's going on, congratulating and rewarding yourself, also going into an elevated emotional state during that period of time. And we kind of look at this like a recipe. It's not that what we're doing is outrageously new. It's about the combination of the therapies that we use in a very specific order, in a very specific way, for a specific amount of time. That is the difference. Because we know that if you have a cake, you put flour and water and eggs and sugar, and if you mix all of the ingredients and put it at 500 degrees for 10 minutes, you'll end up with what? Not a very good cake, right? But if you put those same ingredients in a different way, and you mix the dry ingredients and the wet ingredients, and you bake it at whatever temperature for, what's the right temperature for baking a cake, anyone? 350? 325, 350 for how many minutes? 40 minutes, thank you. I don't bake, obviously. So if you put it in the oven for that much time, then you end up with this beautiful cake. So it's the same thing. There is a specific recipe for changing limbic system function. So the fourth pillar of recovery is incremental training, which is a form of neural shaping that involves some exposure therapy, but it's a very deliberate exposure therapy that's measured and repeated, and it strengthens alternative neural pathways in the brain. And elevate your emotional state. So not only during the steps or the actual sequence of exercises, but throughout the day as much as we possibly can to dampen the threat and survival mechanism that's firing too rapidly. So with a little bit of help, we can actually turn off that stress mechanism. With a little bit of help, I would also suggest that we can reset the cell danger response so that the mitochondria are actually functioning properly again. So how do I know this? It's not just about what I've read. It has nothing to do with what I've read, actually. It has something to do with what I read. That would be a lie if I said it had nothing to do with what I read. It has something to do with what I've read, but more than that, it's about having an internal experience of knowing when your body goes from a state of fight or flight into a state of growth and repair again. And it's a physical feeling. You can actually notice it happening, and it's fantastic because you can actually feel the systems of your body starting to operate functionally again. So those were some of the influences in creating the program back then. My Stroke of Insight by Jill Bolte-Taylor, Brain Lock by Dr. Jeffrey Schwartz, The Biology of Belief by Dr. Bruce Lipton, who really talks about epigenetics, which is working above the level of the gene. Change Your Brain, Change Your Life by Dr. Daniel Amen. And most importantly, The Brain That Changes Itself by Dr. Norman Doidge. It was in reading his book when he was talking about Dr. Jeffrey Schwartz's work with OCD patients. And he was talking about a specific part of the brain that wasn't operating functionally and how that part of the brain would just get stuck. And that's why people felt contaminated, or they felt that they couldn't get away from germs. And I thought, okay, what I have is not OCD, but what if the fear mechanisms in my brain are misfiring, and they're firing so rapidly that it's changing my sensory perception? Because when we're under threat, our sensory perception naturally increases in a self-protective response. So we'll start to smell things, we'll start to see in the dark, we'll start to hear more. I mean, it makes sense, right? But what happens is we kind of get stuck there. So again, looking at The Brain That Changes Itself, so the work of Dr. Norman Doidge, looking at the brain research, Dr. Schwartz, neurolinguistic programming, which is a technique where we can learn how to code information in a different way, and looking at being a curious observer. So how do you recognize patterns, and how do you change those patterns? So basically that's the genesis of the program, the Dynamic Neural Retraining System. It's a drug-free neuroplasticity-based program that patients can do from home. They can do from the comfort of their own home. It's available in 2 different formats. There's the DVD version, which is a 14-hour instructional DVD that's been translated into 8 different languages. I also have a book that I wrote. It was published in, I don't even remember, 2014, I think, called Wired for Healing, Remapping the Brain to Recover from Chronic and Mysterious Illnesses, which has a lot of the science behind the program, but also stories of recovery, not only my own recovery, but various people that have gone through the program. And also there's the in-person format, the in-person seminar, which we just completed, which is a 5-day full immersion program. And we call that Neuroplasticity Boot Camp. Definitely, by far, it is the gold standard of the program, and I would recommend that, of course, people have the gold standard, but if they cannot attend an in-person program for whatever reason, then doing the DVD is a really good option, and also accessing our certified coaches for help and guidance with implementing the program. I want to talk about coaching for a second, because our certified coaches are trained internally. We have quality assurance. They are tested in their knowledge. They are gaining new knowledge all the time. And more than that, they have had their own personal experience of limbic system impairment and recovery through the program. So they have knowledge of the program from the inside out, and they know this program from back to front and front to back, and anything that can come up in the recovery process, they are specifically trained to deal with. It takes a long time and a lot of effort and a lot of energy to become a certified trainer or coach. Coaches have to have recovered for at least a year. They have had to have limbic system impairment and recovered fully through the program, and they have ongoing education, ongoing continuing education to make sure that they are trained in the best way possible with the latest information as it relates to limbic system impairment. So I just wanted to give you some background on that. So what's different about our approach? We question if symptoms of illness may be associated with limbic system dysfunction. We focus on regulating brain mechanisms that can be involved with illness. We focus on rewiring neural circuits in the limbic system that has an effect on the stress response, emotion, pain, memory, and physiology. And we empower our clients to take charge of their own health through teaching them practical tools to self-direct neuroplastic changes for optimal health. It all sounds really good, right? It's like, is this too good to be true? It sounds really good. I'll show you a video in a couple of minutes. So truth number one, so we teach the program from a platform of environmental awareness. So truth number one is that we do know that there are a lot of toxins that can be hazardous to our health, whether that's toxins through chemicals in our everyday living, through new textiles, through bacteria, through viruses, through whatever. We know that that's true, but also, and we want to address those. We do absolutely want to address those. But the truth number two that we're focusing on is rewiring the limbic system. So looking at how the brain has been affected by trauma and really addressing the brain portion of that. So again, toxic overload is often involved with many illnesses like chemical sensitivities, chronic fatigue, and fibromyalgia. Various common chemicals, pesticides, viruses, and bacteria can be hazardous to our health in general, and that's common knowledge. Therefore, proactive environmental awareness is an essential part of illness prevention and overall health. I was talking to someone at the break, and they said, how are we going to get this information out to all of the doctors and what's needed? And, you know, we're doing our part in getting research done right now, but I think also equally what has to be acknowledged is that the environment does play a part in developing illness sometimes. So I think it's really incumbent on us to start to really educate people about what we put in our bodies, what we surround ourselves with, and the hazards that are involved in the environment so that we prevent illness from happening to begin with. I think that that's just a very proactive step that I know that you guys know that could save a lot of suffering, right? The second truth, distorted sensory perception along with a chronic stress response can be sending false alarm messages to the systems of the body. With limbic system impairment, we must relearn how to inhibit the trauma feedback loop and stress response. In other words, we need to reset or normalize the volume on our internal threat and survival mechanisms. We need to consciously relearn how to evaluate threat perception. And again, we teach this program from a platform of environmental awareness. Every product that we make and distribute is created with environmental awareness in mind. So, would you like to see some success stories about people that have recovered with the program? All right.
My husband and I were on our honeymoon in Vancouver, and I was so tired I couldn't get out of bed. We came back and realized that we both had mono, and I never recovered. And also I have genetic testing that shows that I have what is called the dreaded SIRS gene, or the dreaded mold illness gene, which is supposedly the worst gene for people with mold illness to have. I had such severe food sensitivities when I was ill that I was down to less than 6 foods for a long period of time.
I literally slept on either packs of ice cubes, all night because my neck and my shoulders were so messed up. I'm on Tylenol 3s with codeine. I'm on Fiorinol. I had no energy. I didn't want to do anything. I didn't have the energy to help my wife clean up around the house. I didn't have the energy to cut the grass. Because I'm tired and lay down for a nap on a Friday morning and wake up 3 to 4 days later.
This is my wheelchair. These are my Hot Wheels. And it keeps me reclined so that my blood pressure is more at an optimum level because I'm vertically challenged. When I stand up, my blood pressure just drops. And when that happens, it makes your heart rate just shoot through the roof.
3 things that happened at once. I moved into a moldy house with Stachybotrys black mold, and I also was treated by a doctor with prednisone at extremely high levels and had what was called prednisone poisoning, as well as a Benadryl overdose at the hands of a doctor who accidentally gave me twice the normal dose in one day that a human being should have.
And within about a year, I was diagnosed with Lyme disease. And then just all sorts of weird stuff, sensitivities to light and to touch, to smells.
I saw 45 medical specialists, and my husband and I figured that we spent between $100,000 and $150,000. I had several specialists say, "You are the toughest case I've ever seen."
So then the search starts. Chiropractor, naturopath, homeopath, any old path. 25, 26 doctors later, almost $600,000.
I went to the Mayo Clinic a few years ago, and they were really good at diagnosing the problem, but they don't necessarily know how to get you to the next step to recovery.
And eventually, over time, it was a total of 35 different specialists.
Other kinds of treatments that I have tried are a complete environmental medicine protocol with bioidentical supplements and herbs and whatnot to support my liver, dieted and juiced and cleansed and flushed my way to the moon and back 60, 100 times. I'm so clean, I'm clean as a whistle, so technically if that theory were completely true, I would be healed by now. EFT, tapping, shamanic work, juicing, fasting, hydrocolon therapy, electric treatments, plugs, boxes, aromatherapy, color therapy, belief work, up the wazoo, all of it.
Even after the years of treatment, 4 years of treatment, and seeing an incredible doctor in Kansas who, got rid of facial paralysis and all sorts of neurological stuff, helped me to walk again, got me out of a wheelchair, I was still dealing with a lot, with multiple chemical sensitivities, with anxiety, with post-traumatic stress type stuff from the years of illness. A good friend of ours, actually, who herself struggled with Lyme disease, her son and her daughter as well. She did the DVD program, the Dynamic Neural Retraining System DVD program, and she saw immediate and incredible results.
And I went to the limbic system thing, which was Annie Hopper. And I started crying because I knew it was it. I knew I'd found it. I knew I'd found it.
Please send me a sign. We got that sign from her functional medicine doctor. That turned out to be the key to Lauren's recovery.
So I'll try YouTube. Type in multiple chemical sensitivities. Up it comes. Pictures, faces, people. This really clicked when up came brain injury. It's a trauma to your brain.
I heard about the program from my doctor at the Cleveland Clinic Center for Functional Medicine, Dr. Patrick Hanaway, whom I feel very indebted to and grateful for. And at one point I said, "I'm really feeling hypersensitive." And he said, "Oh, there's this program I heard about. from a colleague of mine, and why don't you look into it? I knew the program was going to be a great fit for me because all of these people who had been to so many doctors and tried so many things, who had chronic and mysterious illnesses, were getting better. And not just a little bit, but a lot. I got the DVDs in the mail and I started them that day. As the weeks progressed, my healing took off. I don't have to wear a mask anymore. I can go into any store I want. Now I can eat anywhere I want. And this program has given me my life back.
I'm not tired like I have been. My muscles want to go. The energy is just off the charts. It's unbelievable to experience this, and I'm dreaming again.
I'm supposed to go on to talk about what my life is like now. And, well, of course it's dramatically different. I'm sitting here, I'm talking to you. I'm not closing my eyes because it's too bright. I get to be who I want to be. It's great. I get to laugh and really have a good time.
I'm just so thankful to Annie and her program because I have my daughter back again.
I can do anything. Like, I am living the life of a 20-year-old. I am healthy and strong. Last year, I climbed a mountain, and that was like 3 or 4 months after the program. And I did like a 7-hour hike. I'm playing hockey. I'm working out like 3 times a week. Yesterday, I ran at 10.5 miles an hour on the treadmill. Right away in the first 5 days of the program, I knew that this was the real deal.
I noticed how my brain was perceiving input differently. I was clearer, I was more focused, but most of all, I was feeling happiness and hope, which I hadn't felt in so long, and that inspired me to keep going. And now, cut to 1 year and 9 months later, almost 2 years later, and I live a completely different life. I am an absolutely 100% a totally normal person. Whereas before I couldn't do anything, now I can do everything. There's nothing that I cannot do. That's the question, is what can I not do? There's nothing I cannot do. And one of the biggest benefits of this program is the happiness and the joy that comes as a result of recovery. When your limbic system is in an optimally functioning state, you're happy, you're relaxed, you're confident, and you're in love with life. And once the limbic system is recovered, your mind is open and available to savor and enjoy the beautiful moments of life and to be present to all the miracles that are unfolding every day.
So it says for a full list of testimonials, you can go to retrainingthebrain.com. I always get choked up when I watch that because it's just so endearing to watch people get their lives back. And we have 2 members of our team here tonight. Michelle, who has her own recovery story from electric hypersensitivity syndrome, chemical sensitivities, food sensitivities, Lyme disease, and Emily, I forget exactly what you had suffered from before.
Food sensitivities, chemical sensitivities, light and sound, and some other really odd things that nobody can figure out.
So thank you. So yeah, there's all kinds of testimonials on our website from people that you wouldn't think that would be able to get well, but also and we're really behind in editing those testimonials. I wanted to move forward about how can you as a medical practitioner, what's your role in the recovery process and how can you help? So how many people are suffering? We know that 1.4 million people in Canada alone are suffering from either chronic fatigue, fibromyalgia, or chemical sensitivities. If the numbers equate into the States, in the US, that's over 13 million people, and that's just with those 3 illnesses alone. There's a spectrum of illness severity. It can range from mild to severe. What we would like to see, and how I measure the success of the program, is how long people have been sick before they hear about us. So what we do is at the beginning of a program, so we just held a program for 20 people. With 20 people, I added up how many years people have been suffering. It was 214. And that's actually an improvement. Usually it's over 300. So I am grateful that that number is decreasing and getting less, but what I'd really like to see, actually it was really good. In this group, we had 11 people who have been sick for less than 10 years. I was like, yay! Then out of those 11, 5 people have been sick for less than 5 years. I was like, that is fantastic. What I would like to see is diagnosis and appropriate treatment as soon as people present at whoever their first doctor is that they go to say, these are my symptoms, and how to have that properly diagnosed and treated sooner. So again, we usually see people on the severe end of the spectrum. I would really love it if we could start doing something while they're in the mild end of things before they get to the severe end of things. So the role of the primary practitioner in the recovery process, I actually gave you a handout. And limbic system rehabilitation is a complementary treatment method that assists in the recovery process. So this is something that you can recommend for your patients while they're doing whatever forms of treatments that they might be doing with you. So the question is it all in your head? Absolutely not. It is not in your head. This is a physical brain trauma, and that is another thing that you can reassure your patients is this is a real trauma. It's very real. Some kind of trauma, whether it's viral, bacterial, etc., has affected the way that your brain functions. You're now unconsciously stuck in a chronic fight or flight response, and it could be affecting multiple systems of your body. The good news is that there's a way out, and you can be involved in your own recovery process. How do you think that that'll make them feel? Pretty good? Pretty empowered? Hopeful? So DNRS may be used on a referral basis. So a lot of doctors already refer their patients to us. Dr. Patrick Canaway, who was awarded the Linus Pauling Award at the Institute of Functional Medicine last year, wrote a glowing letter of recommendation to me. I'm actually in talks right now with some researchers in Finland to get some research done in Finland. And Patrick's referred at least 20 patients to our program at the very least, and some of his worst patients too have gotten better, so that's pretty fantastic. Also psychotherapists, counselors, people across the board, they refer people to the program. I also wanted to talk a little bit about the difference between what we do and meditation. Certainly it would fall under the umbrella of mindfulness, but the difference is we're very active in redirecting thought, emotion, and behavior processes. So it's yes, becoming self-aware, and also acting back in a very specific way. So very different from meditation. So diagnostic tools that you might use with your patients. So I think some of you actually already use this, which is the self-assessment tool that we have on the website. It's about 29 questions, I forget now. I don't know, 27 questions that might indicate if you have limbic system impairment. So looking at various things like sensory sensitivities, emotional reactions, physical reactions, behaviors, and so forth. So that is one tool. Another way that you could measure clients' baseline and then measure results is looking at standardized surveys that have already been done. So standardized surveys, and this is actually the study that McMaster University is doing, and I have this on a handout for you. So the McMaster University in Hamilton, Ontario is doing observational studies right now on DNRS. These are the surveys that they're including in the research. So the SF-36, which measures quality of life, the Quick Environmental Exposure and Sensitivity Inventory, which is called the KEZ, which measures chemical intolerance, the Fibromyalgia Symptom Impact Questionnaire, or the FIQR, the Fatigue Severity Scale, the FSS, the Generalized Anxiety Disorder 7-item scale, the GAD-7, and the Patient Health Questionnaire, the PHQ-9, which measures levels of depression. So again, limbic system impairment can express on multiple levels: physical, emotional, behavioral, and psychological. So not only in the systems of your body, but your emotional set point, how you behave, and your thought processes. So if we look at physical symptoms, they can express in your mood, autonomic nervous system function, cognitive function, coronary or heart, digestion, detoxification, gastrointestinal, genital urinary, head, so any kind of pain in the head or pressure, your libido, loss of sexual desire, musculoskeletal, neurological, so burning, tingling, or seizures, neuromuscular, pain, especially chronic pain, respiratory or mucous membrane, sensory perception, skin, and speech. And I'm sure there's probably a lot more that I haven't mentioned here. Psychological symptoms may present as an exaggerated negativity bias. So let's talk about that for a second. The brain actually naturally has a negativity bias for protective reasons. And it's back from caveman days when we used to have to assess a threat really quickly and run. So in any situation, our brain will automatically look at what's not going right or how we might be in threat before it will notice what's going well. So you can imagine for someone who has limbic system impairment and the threat and survival mechanisms are firing really rapidly, that negativity bias is really exaggerated. So intruding negative thoughts, suicidal ideation, a focus on safety and survival, and a preoccupation with real and perceived threats. Emotional symptoms may present as an overreaction to emotional stimuli like rage and aggression, depression, hopelessness, fear, lack of affect, mood swings, inability to access positive emotions, and lack of bonding. That's particularly interesting, I think, that lack of bonding one. Behavioral symptoms may present generally as avoidance, isolation, and talking about symptoms of illness all the time. And I get it, because when you feel like you're dying, that's all you can talk about is how can somebody else show me how to live? Because it's the only thing that's always going through your mind is how do I get better? How do I get better? How do I get better? So some baseline testing that you might look at: MSH, TGF-B1, MMP9, C4A, ACTH or cortisol levels, HLA, and this is based on what doctors are telling us that they do with their patients already. So you might want to take some baseline testing and do some follow-up testing around that as well. And more on testing: VEGF, ADH, leptin, VIP hormones, CD57, and if you're really feeling ambitious, a neuroquant would be a great idea. So that measures, it's a functional MRI, a specific program that measures brain volume and changes, structural changes that are happening in the brain, and measures inflammation too. So wouldn't that be nice to know? Also some autonomic testing, heart rate variability, and a tilt table test, and a test to check for neural inflammation is a visual contrast sensitivity test. So many of you might already be doing those with your patients, so you can actually track how your patients are actually changing and implementing the program and how it's affecting different systems of the body. So how might you interact with your patients that have limbic system impairment? One is to ensure that conversations have a positive context. Please avoid fear-based discussions. 2, reassure the patients that the illness is real and that it is not their fault. It's a real, very real brain trauma. Number 3, describe how limbic system impairment expresses on many different levels. Number 4, that they will be actively involved in rewiring their limbic system for optimal health. Number 5, refer patients to our program. Number 6, perform diagnostic testing at baseline and at measured intervals for 1 year. And you may find that a lot of your patients actually get better before that, but it'd be really nice to have some interval testing to see what changes are happening and when they're taking place. Ask your patients to report positive changes either on physical levels, emotional, psychological, or behavioral. Number 8, reassure your patients that recovery through neuroplasticity is not a linear process. And that's sometimes a difficult one because you can have 2 steps forward, 1 step back, 2 steps forward, 1 step back. I remember someone on the community forum had written a diagram about what recovery through neuroplasticity looks like. And this is our expectation, to go from here to here, but the recovery process actually looks like this, right? So what we need to keep in mind, though, is that the presence of symptoms may not be an indicator of recovery. So it takes time for those new neural networks to build and solidify. And sometimes it can seem like overnight, all of a sudden 20 symptoms fall away. Or it can be gradual, and then you hit a plateau, then you have a spike in symptoms, and then all of a sudden the next phase is 20 more symptoms drop away. So it's not a linear process, so understanding limbic system function and the rehabilitation process is really important during the recovery phase. They can't be afraid of their symptoms because their symptoms may come and go during the recovery process. Is that making sense? Good. So what else? Check in with their level of commitment with integrating the program. So just ask them, so how are you doing with the program? Are you practicing every day? Is there assistance that you need? Have you reached out to the people at DNRS? Did you book coaching? Are you actively engaged on the community forum? Do you practice with other people? So a lot of people have practice buddies that they practice with that help them stay focused on actually implementing the program. So there are a number of ways that you can encourage your clients. So we have some follow-up resources. We have the DNRS Community Forum. So anyone who has gone through the DVD or the 5-day seminar gets an invitation to join the Community Forum. It is professionally moderated by one of our staff. The guidelines on the Community Forum are the same as in the seminar. So, in most support groups for illness, you'll hear people talk a lot about what it's like to live with the illness. Our focus is not on that at all. It's about recovering through neuroplasticity and what are your victories. How are you doing well? What's changed psychologically, emotionally, behaviorally? So really looking at the changes that are happening. And also our certified coaches. So we have, I think, 12 certified coaches now. And they're available to help any of our clients with implementing and understanding the program in the best possible way for forward momentum and recovery. So possible contraindications to treatment: extreme stress, mental illness, personality disorders or schizophrenia, or a complete lack of motivation, because people will need to be motivated. And we can give you the tools and we can provide some structure for implementing those tools, but we can't do it for you. So they do have to have some motivation. But it's amazing how many people are really motivated. You would think that really sick people wouldn't be motivated. Actually, really sick people are really motivated. They're amazing. They should get Olympic medals for their motivation because it's really astounding. So just some data analysis of summary that we collected. This is in March 2017. I presented this at the IFM as well. We looked at the purpose of collecting the data was to assess the effectiveness of the DNRS for participants suffering from multiple chemical intolerance, which is a condition that is often involved with multiple chemical sensitivities, chronic fatigue syndrome, fibromyalgia, and electric hypersensitivity syndrome. So we tracked 589 participants that attended the 5-day seminar immersion from September 2009 to March 2017. They all completed the Quick Environmental Exposure and Sensitivity Inventory, or QESI, by Dr. Claudia Miller at baseline, 3 months, 6 months, 12 months, and 36 months after DNRS. And if you want to know more information about the QESI, certainly look it up online. It basically measures different systems in a whole bunch of different different levels. So head-related symptoms, cognitive, affect, neuromuscular, musculoskeletal, skin-related, genital urinary, gastrointestinal, heart or chest-related symptoms, and air or mucous membrane-related symptoms. So the data analysis, the risk criteria for determining the degree of which multiple chemical intolerance is suggested, we only included people that had symptoms severity score of greater than 40 and a chemical intolerance score of greater than 40 as well. The number of participants then was at 138. We looked at possible triggers prior to illness onset. We had virus and bacterial infections, renovations to their office or home, reaction to prescribed medication, pesticide exposure, other chemical exposure, mold exposure, head or neck injury, dental surgery, or psychological or emotional trauma. And usually, as I said, it's a combination of all of those, or some of those things. So what were the results? Looking at chemical intolerance, other intolerance, symptoms of severity and impact of life, there was almost a 50% change in symptomology. In fact, a lot of people no longer met the criteria for actually being diagnosed with chemical intolerance at that point. So there were, of course, we want to look at worsening, possible worsening of symptoms. So there were, how many people here? 1, 2, 3, 4, 5, 6 people that recorded a worsening of symptoms, but it was very mild. Looking at the percentage of change, it was very, very mild in all of them. Specifically 4.1, 3.5, 5.9. I mean, on any given day, the symptoms might change, so it's really hard to tell with a survey like this exactly what's happening. What I would love to see, this is what I would love to see, what I would love to see is the brain scans and all of the biomarkers so that we know what's actually happening with the brain and we know what's happening with the systems of the body as well. I think that will be the true indicator of how the program is actually affecting change and what systems it's affecting change in, not just the brain. So on that note, we are having research done right now. There are 2 research projects and perhaps a third coming up in Finland. But the first one is at the University of Calgary and the University of Alberta are conducting independent research on the impact of neural retraining in patients with multiple chemical sensitivity, chronic fatigue syndrome, fibromyalgia, and postural orthostatic tachycardia syndrome. The University of Calgary is a leader in brain imaging and brain research, and the University of Alberta's Integrative Health Institute is a leader in researching integrative medicine. Investigators from the University of Calgary and the University of Alberta have teamed up to start the first phase of this work. I think right now they're in the second phase of this work. McMaster University Department of Family Medicine in Ontario, Canada is conducting a prospective observational research study to gather information on outcomes of 100 participants who've attended the DNRS Interactive Training Seminar. So far, they've gathered baseline information on 67 participants. Over 90% of the participants agreed to enroll in the study, and there will be 1 year of follow-up. The primary research question is, what change in quality of life score is observed through the first year following completion of the DNRS group seminar when compared to pre-seminar? The second question is, what symptoms and diagnoses are found among people who enroll in the program? Which symptoms and diagnoses are most likely to show improvement through the program? And what demographic characteristics, disability characteristics, and post-seminar practice patterns are associated with likelihood of improvement? As I said before, they're using those 7 standardized surveys that I talked about earlier, and so we don't have to go over those again. Of the 67 people who were included so far, the average age of the participants is 51.3 years, 85% are females, and 30% have a master's degree, and 12% have a doctorate degree. So this is a very highly educated group of people. Participants reside in the US, Canada, and various European countries. The average number of diagnoses per person is 7.4. There are more than 38 different diagnoses. Here are the top 14. Multiple chemical sensitivities, chronic fatigue syndrome, neurological disorders, anxiety disorders, Lyme disease and co-infections, depressive mood disorder, chronic inflammatory response syndrome or mold toxicity, food allergies or sensitivities, fibromyalgia, migraines, headaches, adrenal insufficiency, body pain or chronic pain, post-traumatic stress disorder, and irritable bowel syndrome. So, in closing, neuroplasticity represents the brain's ability to change. It is an intrinsic quality of the brain that is neither good nor bad. The ways in which the brain changes in response to trauma or change are not always good or healthy. Early diagnosis and treatment of limbic system dysfunction can prevent years of needless suffering, and limbic system rehabilitation moves the brain and body from a state of survival into a state of growth and repair where healing and full recovery are possible. So again, that is our website, retrainingthebrain.com, and I think that's it. I just want to say thank you so much for your time, for your generosity of spirit, and for coming to attend the talk. I really appreciate it. I'm glad that I was here in Austin teaching a program last week, and thank you so much for organizing this. And Michelle, thank you for providing the space and all that you do. And for Emily, thank you too. Thank you to all of you. If you have any questions, I would love to answer them, but I'll get James to stop filming.